Hello, and thank you so much for joining SilverCare as a school therapist. There are a few pieces that we're going to be covering today. The first will be how you will be seeing your clients. Prior to seeing any client, you will need to receive the okay from the office. The way we do that is that in the beginning of the year, you're going to have a caseload in Therapy Boss of clients that have been pre-approved. If you have not yet received a caseload on Therapy Boss, you should not be seeing any clients. This is how the Therapy Boss app looks. When you log in, you will see your patients over here. You will receive your login from the office, and you should be able to download your app either onto a computer, a laptop, a phone, or a tablet. Now, all your patients should be in here. If during the year a child wants to be seen, or the school wants a child to be seen who is not in your caseload in Therapy Boss, please tell the school to reach out to the office and wait until it has been added before seeing them. That can take up to 2 hours. In your office, you must always have a loose leaf with all the required documentation in it so your clients can see their rights and responsibilities at any time. You will be given this loose leaf as well as your room numbers at the time that you are beginning to see clients in schools. The way your day works in the school is that your schedule will be given to you by the school personnel. Each client can be seen for either 30 minutes or 45 minutes. You will see your client in your office and put your note in accordingly. How you put your notes in is how you will get paid. So we will now go over it to make sure you are putting in your notes properly. Included in this billing time and in your note time is if you need to make up a behavioral plan for the client, etc. So when you're finished this session, you're going to open up your Therapy Boss app and pull open the child on your caseload. I've included a few dummy patients for the sake of this recording. For the first visit, we're going to choose Esther Philbiger as a new client. For the first visit, you're going to need 3 different documents. Post that, you will only need 1, but for the first one, you're going to need 3. The first is called an admission consent. So we are going to do a new non-visit document. We're going to choose the admission consent, and you're going to choose save. Now, there's a full rights and responsibilities here. The child is the one who you have to make sure to click off the NA on the bottom here, and the child is the one who would sign it. If the child does not want to sign it, that's okay. You can sign it for them because we will be getting this from their parents as well and leaving in the office. Once you do that, you click save and you are done with your admission consent. I'd like you to notice on the top that it's green. When you finish a document, it's green, which means that it is completed. If your document is ever red, it means it will not come to the office. So just make sure if it's red, it could be that you didn't check off the NA, it could be it wasn't signed, etc. So here we would click save and you see how it's green, so the answer is yes, it's ready. So we got the admission consent in. The next one is going to be the plan of care. So again, it's going to be a new non-visit document and it's going to be a plan of care. Now, obviously on the first visit, you're not going to know that much about the patient or the client. So you're going to be putting in what you feel, a working diagnosis, some goals and some interventions, but keep in mind that this can always be edited later on. You can change it after speaking with the school, what their goals are, what the parents' goals are, etc. In this case, we put in generalized anxiety disorder, but you would click on the pertinent diagnosis and you would add it over here and click plus. The goals, we're going to choose, you click the 3 dots and we have different options of what might be going on. So perhaps you notice low self-esteem. Perhaps you also noticed that they're a little ADHD, that their behaviors are an issue, etc. So you may set a couple of goals that you would have. And then by the interventions, you want to make sure very clearly that you are choosing first, the very first one, the CPT codes. You have to choose all the different types of codes that you might use as interventions. So you might be doing a shorter session, a longer session, or a family session. These are different options that you'll be using. So that is a must. You always have to include that. After that, you would also do continued interventions for example, ADHD, which might be whichever ones you feel would be helpful. We encourage you that you always should add at least one of your own interventions and one of your own goals, not just go through our pre-populated ones. So going back to that low self-esteem, we may feel that we want these 3 items. So now we have a lot, and let's say I would add in here also develop rapport by playing, whichever games in office you have included. So I would add my own in there. Now the last thing, notice it's still red, and the reason it's still red is because the visit frequency was not authorized. Now the visit frequency is how often you assume that you're going to be seeing this patient. Again, this is not necessarily something isn't changed. So you may feel that you'll be seeing them 4 times a month, possibly. So we're going to save that. We're going to put in that you're seeing them 4 times a month, and you hope that it's only for 2 months. Perhaps this is a child who you're not going to be seeing very often. You click save, we click OK, and here we have the green light that we have our full plan of care in, and we're going to click save. Is this completed? The answer is yes. We are now going into the note that you are going to be using with every session, which is going to be the follow-up note. So we're going to do a new visit activity. Okay, now this is the one that we're going to be putting in when we actually saw the client and for how long. So we're doing, it's not, with these two, notice I did new non-visit document. This is going to be a new visit document. So here it is, 9:05, perhaps I saw her for 30 minutes. So I'm going to do the follow-up note because this is an initial session. So every session is always going to be a follow-up, but I'm assuming it's 30 minutes because it's an initial session. So the type of note is going to be the follow-up note. Okay, this is saying, because I said once a month and I already put in the plan of care, so we're going to do, what we're going to do is, this is an example of something you might change. I'm going to unlock the change button. I'm going to click change, and by the visit frequency, I am going to change it now to, I'm going to unlock it on the side, and I'm going to change it to twice a week, okay, for this first month. And that is because we want to make sure that we have enough time to see this patient. So again, you can always change things as needed. So let's go back now. We're going to try again the new visit activity. We are going to do a follow-up because that's always the note that you're going to be using. We're going to click save. Okay. Now, the amount of minutes that we're seeing this patient for is going to be 30 minutes. Okay. There's no signature required for this. We are going to add the note, which is the social work session note. That's the note that you're going to be choosing. Now it's red because there's a lot of things that we didn't finish here. So we're going to go through them. Are there any risks and precautions? Did the child say something suicidal? In this case, none. Are there any observations that you noticed right in the beginning? You know, the child was acting moody or etc. In this case, I'm going to choose none. Change to care plan goals. We don't have any changes to the goals and interventions. However, obviously we performed some interventions. So let's choose what we're performing. The first thing, very, very important, this is how we know how to properly pay you for your time. So you must choose which one of these are you going to be using. Are the parents in the session? In that case, it would be family. Is it a short session? In this case, it would be this one. Is it a longer session? So the first thing is you're going to have to choose one of these 3. So in this case, I'm obviously choosing the shorter one. And I'm also saying that the interventions that I worked on were maybe express feelings through artwork. Okay. Now, we want to briefly describe this activity. So client drew pictures of her family and her home, so therapists can get idea of what issues are coming up. Okay. Now in this case, you would just write the same code again, just so that you can say that you did that. Okay. So here's our interventions performed. We didn't have any progress towards goals because this was certainly the newest one. We definitely did not have any achieved goals. Were there any additional comments? Are there instructions to a patient or caregiver? There was no supervision taking place. The place of service in this situation is going to be the office, the clinic, because the clinic is where the child is being seen. It's a clinic in the school that the child is being seen in. There's none at this time, none at this time, none at this time. Now, we still show red. So let's see what we still need to finish out. It says progress towards goals. okay? So we have to choose the progress towards goals. So let's say that we would have on this goal thing a develop rapport goal. I would have chose that. But let's say we chose this goal and we have to say, you know, how that child is progressing towards the goal. So child is, you know, able to identify one behavior that she will work on this week. Okay. Why else is it red? It says instructions to parent and caregiver. So we actually, now this, just so that you know, this note will be changing in November. So you'll be getting an updated video in November because this note is not fully for our system. So they are developing a different system that will be a different note that will be more helpful for our system. But in this case, we're going to say instructions to the patient or work on one behavior for upcoming week. Obviously, I'm giving a very brief note. Your note would need to be a little bit more involved. So here we have the green light that we had 30 minutes. We made sure that in our interventions, we discussed which session it is. We're going to click save, and this activity is ready to be completed. So our first time seeing someone, these are the three things that would come up: the admission consent, the plan of care, and the follow-up note. Moving forward, you would always just do a new visit activity and choose the follow-up note. That would be the moving forward option. Now, there's one other piece that's very important, and that is in regards to speaking with school personnel and meeting with principals and teachers. This is a very important part of the school system, and obviously it's not a session, so you can't put it in under a client's name. So what we have is, and you are going to have one client in your therapy boss that is called case management. And this is where you're going to document any time that is not included in seeing the patient or working with the parents. And the way you are allotted that is that you are allotted up to 20 minutes per week per client for case management. That time will be automatically pre-populated, so you don't have to worry about going over. You won't be able to put in a note more than you are allotted, and you can see how much time you've used up in the authorizations tab. Right now I don't have anything in here, but you'll see it'll say, let's say 20 minutes of 120 minutes, and these minutes are rollover. So what that means is that if you don't use it for one client, you could use it for another. And if you don't use it 1 week, you can use it the next week. So you'll see it as a full rollover, and you do not have to worry about going over. The system will stop you. The way that you would do it is you're not going to choose a follow-up note. You're just going to choose a case conference. Okay, whenever you meet with the school, with the teachers, with the principal, etc., you're going to choose a case conference, and you're just going to choose an activity addendum, which means that you're going to write what happened. Clinician met with school to discuss a variety of patients. It can be as simple as that. It can be more detailed. Just make sure you put in the right amount of time, because again, we want to make sure that we're paying you for the time that was done. And that's all you need for that. And it's green. You would click save, and you have in here the 20 minutes that you saw this client for. This principal or teacher for. Any questions about this, please don't hesitate to ask us. We are here to help guide you through this process. We very much look forward to working with you, and thank you so much.